All right, welcome back, everyone. If you want to take care of your brain, you need to get a good night's sleep.
Yeah, sounds so simple, but for many of us, a good night's sleep is just a dream. The Alzheimer's Association Connecticut chapter is now holding a virtual series about healthy brain habits, and sleep is really the top topic for this February 1st program.
Joining us now to tell us more about it is Dr. Amit Khanna, Medical Director of the Sleep Center at Yale New Haven. Thank you so much for being with us. Kara and I are fascinated by sleep and the lack thereof that we get.
I really love it, though, Doctor.
Thank you for having me.
We really need it, right? I mean, but talk about this. You know, I was always the best sleeper. I thought I could sleep in so well when I was younger. I mean, as a teenager, even to 11 or 12. As we get older, how does our sleep change, and how many hours do we need?
So, as we age, typically over around midlife, things start to change with regards to how much sleep we need, in the sense that we start to go to bed a little bit earlier, but and get up earlier. The amount of hours you need is typically not dramatically changed, but how it's distributed changes. Sometimes we'll nap during the day as we age, and we'll have more disrupted sleep at night. There's a tendency to wake up a little bit more during the night, whether it's just to go to the bathroom or for reasons unknown, or perhaps related to medications, pain, or other illnesses that somebody might be dealing with. And then other things that change is that the distribution of the stages of sleep. We get a little bit less slow wave or deep sleep during older years, and this could have implications on our overall health and well-being.
Is there an average number of hours that we should be getting every night, or is that changed by age?
Well, typically in adults, we want to get between 7 to 9 hours. There's no magic number for one person. It really just comes down to what allows you to feel rested and functional during the day. And so you're not struggling, and so you don't feel like the quality of your life is impacted. But if you do feel like you can't enjoy activities, or every time you sort of sit down and relax that you're dozing off, then maybe you aren't getting enough hours of sleep, or perhaps the quality of the sleep is not as restorative as it could be.
Yeah.
And there's just a variety of factors, really, when it comes down to it.
You know, a lot of us are just thinking, oh, sleep, I just can't get it. But when you hear that it really is connected to Alzheimer's disease, that's something to perk up about and to pay attention. How does it impact our brain health?
So some newer information that's coming out is really showing that getting some of those deeper stages of sleep, such as slow wave and REM sleep, are related to sort of how our brain flushes out toxins, and sort of keeps our brains healthy and helps our memory consolidation and storing our memories and sort of recalling our memories. And if you're compromising the quality of your sleep for whatever reason, by sort of poor sleep hygiene or activities that you might be doing, or if it's medical reasons that need to be addressed, it could have implications on your sort of overall cognition, mental health, and some risk factors are pointing towards dementia.
February 1st is coming up quickly. What is going to be taking place that day?
Doctor?
So we're generally going to have a nice Q&A session, a virtual session for people with the Alzheimer's Association, and really just try to answer questions on things that you can do to sort of improve the quality of your sleep, whether it's for yourself personally or maybe somebody you're taking care of. And sometimes even the people who are the caregivers have impacted sleep just because of the nature of what they're doing.
Right,
And
right.
there's so many things we can do, just looking at the term sleep hygiene, as far as just healthy practices we can all put into place.
So I know you would tell us not to watch TV right before we go to bed and not do work in our beds. I mean, those are kind of the basics. Make sure that we're hydrated. What about, you know, especially in midlife, women really in the perimenopause, menopause years, I know that sleep is a big problem. They're waking up a lot more, hormonal changes. Is it okay sometimes to take a sleep aid, like a little bit of natural melatonin or things like that, to really help people sleep better?
So they can be a temporary fix, and in some cases are used long term, but we typically don't like to reach for medications as a solution to sleep. And there are, what our literature has shown, hands down, in head-to-head studies, there is nothing better than making behavioral modifications for long-term benefits with sleep. And sometimes you just need assistance. Sometimes we lose sight of the trees from the forest, and there can be simple things or sometimes a little bit more involved things where you need some coaching. Um, but it can really often be fixed without medication.
Okay.
But of course, there is a place for medication. But if you're going to use them or feel the need for them, you should do it in conjunction with your clinician.
Absolutely. All right, we have to go now, but do you recommend sleep divorce? If your partner's a snorer, do you get out of the bed and move up to another room?
It's probably a time to sort of seek some help.
Yeah.
Okay, well,
All right. You can learn more by visiting the
I do
ALZ.
thank you guys for having me.
Thank you so much for being with us.
Thank you. The New York Times has had an article about that. Younger people are choosing to just have separate rooms like they did in the 1800s and just come together when they want to.
Goodbye.
Sleep is more important.